Hello, today we have with us Dr. Ajay Kaduskar, consulting diabetologist from Nagpur, who will be sharing some important tips on how we can manage diabetes effectively and maintain a healthy lifestyle. What is diabetes and why is it becoming so common today?
Diabetes is, as you are all aware, is increase in blood sugar, but it is not just about blood sugar. There are various reasons why it is increasing in today's time. One, of course, is our modern lifestyle, where there is lack of exercise. We are consuming too much of calories, which is leading to obesity. Then there are other reasons like stress, which increase the level of stress hormones in the body, which increase the blood sugar. And the genetic makeup, where we are as Indians prone for the development of diabetes. So it's a multi-pronged reasons that we are having an increase in the incidence of diabetes.
What are the early signs that someone might be diabetic?
What happens many a times, diabetes gets detected late, and as a reason, for that reason, we get a lot of patients who already have developed the complications. So we need to remember the early signs of diabetes, which can be in the form of weight loss, fatigue. Some patients might have increased frequency of urination. What is important to note is that in many of the patients, there are no signs of diabetes. So if you are prone for diabetes, like say if your parents have diabetes, if someone in the family has diabetes, it is better to get yourself checked rather than waiting for the symptoms to occur. But then there are certain red flags like weight loss, fatigue, which I told you, which should be kept in mind.
Why does uncontrolled diabetes affect other parts of the body?
Why do we need to control diabetes? The reason is that uncontrolled diabetes or the excess of blood sugar in the body damages various organs of our body like eyes, heart, kidneys, our nerves, our blood vessels, to name a few. All these complications that we see, kidney failures, heart attacks, paralytic attacks, injuries to the legs leading to amputation, these are potentially preventable if you control the diabetes at the right time. So right control of diabetes at the right time is the key to prevent all these complications.
Does stress really make diabetes worse?
Absolutely. Stress is one of the important reasons which has a role in control of diabetes. What happens when any person is under stress is that there is an increase in the level of stress hormones, that is cortisol, in the body. This leads to many a times increase in the weight, which leads to uncontrolled blood sugar or the development or the lack of control of diabetes. Secondly, cortisol per se as well can increase a person's blood sugar level. So in today's time, stress management is a very, very important part if we want to control the epidemic of diabetes.
How can family members support someone living with diabetes?
See, when any person in the family is having diabetes, it's not just only that person who has to deal with diabetes. It requires a great amount of family support in the form of, like, say, lifestyle modification, which involves exercise and diet, which play a very important role in control of diabetes. So the diet which the person with diabetes should be having, the family needs to accept that, needs to help him in following that diet, needs to help that person in following the exercise regimen that he has been advised, and in overall the person needs to have a good family atmosphere, a positive family atmosphere.
If someone wants to take charge of their health today, where should they start?
They should start from their day-to-day lifestyle. This is what is in our hands. Have a good diet, a healthy diet, which has less of carbohydrates, more of proteins, more of fibers. Avoid junk food. For stress management, do deep breathing exercises, pranayam, yoga. Have a regular exercise regimen where you are not just walking but you are exercising your muscles as well. Follow the doctor's advice as regards medicine and lifestyle modification, and get yourself checked at regular intervals, which will help you in preventing complications. Every person needs to take charge of his diabetes right from the word go, and where the earlier he takes charge of his diabetes, the better the control would be and the lesser the complications would be.
Issued in public interest by IPCA Laboratories.